Hey everyone, my name is Carlos Sierra and I'm going to present the innate immunity in asthma. Well, the asthma is an inflammatory disorder characterized by irregular inflammation in airway hyperresponsive vitamins to main stimulate episodic using this dyspnea causes pulmonary pollution and bronchial constriction characterized to clinical side effects.
Asthma is a chronic long-term condition that can be managed but not cured. Asthma affects the airways of your lungs. It causes the airways to narrow and swell, resulting in wheezing and difficulty breathing. During breathing or respiration, air goes in through our nose or mouth to the upper airways, at which point it reaches the windpipe, which branches into two large bronchi to reach the lungs. The lungs are protected by the rib cage, which also contains the muscles that control your breathing. In asthma, the airways are oversensitive and easily irritated by certain triggers, called asthmatic triggers. Most people with asthma are described as atopic, meaning they have an allergic type reaction to external triggers, such as house dust mites, pollen, cigarette smoke, animal fur, and chest infections. However, for some people, the onset of asthma is unpredictable and may be caused by anxiety, stress, or even laughter. An asthmatic trigger causes the airway walls to swell and the muscles around the airways to contract. The airways narrow, and breathing through them produces a whistling sound called wheezing. Mucus is produced from the lining of the airways, which clogs up the narrowed airways further and causes coughing. This makes normal breathing more difficult, producing symptoms of asthma that can be mild, moderate, or severe and life-threatening, where hospital treatment is needed. The narrowing of the airways is reversible if the trigger is removed, or if the inflammation is treated medically. Therefore, preventative treatment is used and can be managed by the patient themselves. An acute asthma attack requires medical intervention, but the type of intervention depends on the severity of the attack.
For more information, visit www.nhs.uk.
Well, the pros in the innate immune system consist of those of host defense against infection that are encoded in germline DNA and don't require prior exposure to the innate immune response are rapid transitage, whereas the adaptive immunity response are lower but that's long. Well, the cons microbes may be eliminated. They develop an allergic adaptive human responses through interaction with a group of these innate immune receptors, including receptors terminal like receptors early in life.
No, Mom. No, I haven't had an attack in a while. I don't think that's what's happening. I don't know. Don't worry about it. No. go, okay? I love you. Bye.
So here's what's happening inside your body. The magic of the lungs can only be described by looking at them. They're pink and beautiful, sort of like dry sponges, able to take air in and exchange it for waste stuff and get rid of things you don't want in your body. What happens in asthma is that nice pink lung becomes angry and frustrated, and it starts to breathe really quickly because it can't get the air in.
What's happening?
What you're seeing now is a good example of what happens in an asthma attack or even in a panic attack. Let me take you even deeper. Let me take you to where the real action is, the alveoli. Let's transport you in there, and when we get there, we see these balls of air, and these balls of air are surrounded by blood vessels. You see the red ones are the ones that have gotten new oxygen, the blue ones are dumping waste off. That's how it's supposed to work. The tubes that bring the oxygen to these air bubbles are big and round. You can see one over here, and they're all over me. If I look around, I can see them everywhere because the lung is full of them. So what do? You split down, you slow things down, you get rid of whatever's irritating your lungs, like the pollen, you take deep breaths, meditation never hurt, and then sometimes you gotta take medications, like an inhalant. And when you do that, you know, bathe the airwaves with this chemical that will relax them, allow them to go from that tight squeezed in tube to a nice big open tube, so you once again have oxygen bathing your blood vessels, which is important for you to be able to breathe, live your life, and move around.
Hey, Mom. Yeah, I'm sorry about before. I couldn't catch my breath. I had to use the inhaler. I'm okay now. Yeah.
Well, the dish is amazing. The price and dose of assessment limitations are may depend on the age, the science, and the severity of the asthma limitation side effects, and cause for asthma can change over time. Work closely with your doctor to track the signs and adjust the asthma medication when needed.
For the first time in 30 years, asthma sufferers could soon benefit with a new style of treatment. Experts are trialling a 2-in-1 inhaler, which they hope will protect more people from life-threatening attacks.
43-year-old Kanzi Tamani had severe asthma as a child, and while the danger has subsided, her condition still causes unexpected flare-ups.
When I do get a cold or a flu, or some other trigger like dust or cleaning products or cigarette smoke.
Around 2.5 million Australians have asthma, and of those we estimate that around about 1 million have mild asthma, so it's very common to have mild asthma.
In a year, about 1 in 6 people with mild asthma need urgent medical care. While puffers are effective in relieving symptoms quickly, many patients are not taking daily medication in the form of preventers, which targets the underlying inflammation and mucus in the lungs.
We don't want it to burden people's lives, but we do want them to understand that if they don't treat asthma, it can cause serious events and it can cause long-term damage.
This 2-in-1 inhaler could be the answer in reducing that burden and protecting more sufferers. The Symbicort Turbuhaler contains a reliever and low-dose steroid to reduce inflammation and is only used when symptoms strike, such as wheezing and a tightness in the chest.
The doses that are being used in this study, there are essentially no side effects.
This new approach will be compared to the standard medications. Investigators say if the results of this trial are positive, it's likely to change the way mild asthma sufferers are treated.
We've had asthma guidelines since 1989. This is the first new approach to mild asthma since then.
More than 1 million sufferers like Kanzi could benefit.
Since I've started on the trial, I really don't have to think about it. I just have to have it available. That was very attractive because it just doesn't impact on your lifestyle as much.
Gabriella Rogers, 9 News.
Well, issue of applying maker and estimated 300 million people have asthma worldwide, and the prevalence has increased over recent decades among children living in say countries, and it's also the increase in the world countries where such increase are mainly aligned to environment and trends associated with combination and the acquisition of the modern lifestyle. The multi-century ICAAC phase 3 study estimating an increase in prevalence of with 30% among adolescents aged 13 and 14 years between the 15 study centers in 19 countries. Well, the conclusion is that complete disorder in evidence now suggests that it's not solely attributable in either to large or resident field. Innate immune system respond variety to the triggers, including viral and bacterial components which are now already trigger already. Innate immune response may be involved with the lack of protection against asthma.
Hello and welcome. Today we'll be talking about asthma education for the new asthmatic. In order to better manage asthma, it is important to understand what it is. Asthma is a lung disease that makes it hard for your lungs to move air in and out of your body. You may have been prescribed inhalers to treat your asthma. The first kind is a maintenance inhaler. This is meant to be used daily. It is important to take this medication even if you feel well. The second is a rescue inhaler. These inhalers provide quick relief. They should relieve your symptoms within 15 to 20 minutes. They're for emergency uses, like when you have a flare-up. In addition to inhalers, you may have been given a peak flow meter. A peak flow meter is a portable device that measures how air flows from your lungs. In other words, it looks at your ability to push air out of your lungs. This is a helpful tool to help you manage your asthma. Let's talk about everyday care. As an asthmatic, it is important to identify triggers that may cause you to have a flare-up. Things like pollen, pet dander, dust and smoke, and cold air are something you want to think about. It is also important to monitor your control of your asthma every day. Understand the medications prescribed to you. Don't ever hesitate to ask your doctor about them. Let's go over when it is appropriate to call 911. It is time to call 911 if you are having these signs. If you have extreme shortness of breath, you can't talk in full sentences. If you're straining your chest muscles to just breathe. If your peak flow meter shows a low reading, and if you're getting no relief from your rescue inhaler. Okay, but what if this is an emergency? If you are still experiencing some symptoms, write down what they are and when you experience them. Do some breathing exercises. This can help you relax if you're out of breath. Finally, keep your lungs healthy by staying up to date on vaccines and staying away from asthma triggers. Some questions you might want to ask your doctor are, am I using my inhaler correctly? Show your doctor how you're using your medication so you can be sure you're using it correctly. How do I best manage my asthma? You and your doctor should develop a plan with specific instructions for early treatment of your symptoms. Could my home or workplace be making me sick? Your doctor can help you identify if you are exposed to something at work or home that is making your asthma symptoms worse. You may find the following resources helpful. Puget Sound Asthma Coalition is a group that has great information about living with asthma in Washington. The Asthma and Allergy Foundation of America has a hotline you can call for more information about asthma. TFD Cares is a fire department-based program that can find resources for you to prevent asthma attacks. Thank you so much for watching our presentation. We hope you have learned something new about asthma today. We would like to thank the following institutions and individuals: the American Lung Association, the Tacoma Fire Department.
Well, that's all. Thanks.